So hi, I'm Karen Jones from the University of Kent, and I'm going to be chairing this session today. So welcome to the webinar, which focuses on the interfaces with social care. Please use the chat box to share any questions, thoughts you have during our two presentations, and we'll discuss them at the end of the presentation. And also I will open up for further questions if you've got time. It would be appreciated if you stay on mute during the presentation. So we have two very interesting presentations. We have Sue Tucker from the University of Manchester, who will be presenting on care and support for people with social care needs in prison. And this will be followed by Tanya Stern from the King's College London, who will be presenting on the impacts of climate change on adults in need of care and support. The presentations are 20 minutes, followed by 10 minutes for questions. So Sue is going to be the first one to present. So over to you, Sue.
Okay, thank you. So what I'm hoping to do over the next 20 minutes or so is to talk about two linked studies on the social care needs of prisoners. The first of which will be my main focus, was undertaken as part of phase 2 of the School for Social Care Research, and it looks at the needs of people in custody. And then the second one, which I'll just briefly mention at the end, is an ongoing study of the social care needs of people released from prison. As you can see from the long list of names of the people involved in the first of these studies, however, this is by no means all my own work, and I particularly wanted to give a mention to Claire Hargreaves, to whom I sent a very long and boring list of points that I thought we might want to cover today, and who produced this much more interesting set of slides for which I can take no credit whatsoever. The whole thing, however, has been a collaboration, and a very pleasing collaboration, between Social Care and Society, formerly PSSRU, and the Offender Health Research Network at the University of Manchester. And we're really hoping that this is work we can build on and take forward. My slides aren't moving on. To go back one. Okay. So by way of background, I wanted to start by talking about three things that I thought were important that people understood as sort of a reason for rationale for doing this work in the first place. And the first is just a recognition, a general recognition of the level of social care needs in prison and its increase. So you're probably aware from the newspapers that certainly from sort of 2000 through to about 2017, simply the total number of people in prison has been increasing. So it's risen by around a third since the turn of the century, and has sort of stabilised at around 85,000 now. But in particular, there's been a rise in the number of older people in prison, partly because of demographic ageing, but also because of a trend in longer sentences, a surge in retrospective prosecutions as forensics have improved. So older people in prison, who frighteningly get defined as people 50 and above, now make up about sort of 16–17% of the prison population. Although I shouldn't forget to say that there's also a significant number of younger people with mental health problems, physical and learning disabilities, long-term health conditions, for example, in prison, who will also have social care needs. So we've got this increased demand for social care, if you like. We've also had a whole series of reports since the turn of the century about the variable provision of social care in prison. And as recently as 2014, one national survey found that only a quarter of prison establishments had social workers involved in assessing or providing care for people in prison. And the literature, if you read it, it's got a sort of a plethora of examples of poor instances of social care, to the extent that people in wheelchairs have been allocated upper level bunks that they're just not able to access. And if you think about why this might have come about, the consensus seems to be that it's largely been due to a former lack of clarity about who was responsible for the provision of social care in prisons, with confusion about whether or which local authorities might be accountable. And that's led to this sort of consequent low level of engagement. So it's not surprising that the introduction of the CARE Act in 2014 actually came into implementation on the 1st of April 2015 was widely welcomed. And that clarified that the local authority in whose area a prison was located was responsible for identifying and assessing people with potential social care needs, and where they met the national eligibility criteria for providing or commissioning appropriate support. More widely than that, however, they also have a responsibility to prevent, reduce or delay is the phrase, the development of social care needs for prisoners more generally. And all authorities, regardless of whether or not they've got a prison in their area, are responsible for the continuity of care of people who come into that area with a package of care on release from prison. So it's not just of relevance to authorities that have got prisons in their catchment areas. For people who aren't familiar with them, there are 10 domains in the national eligibility criteria as set out here. And you can see that these encompass not only the sort of personal care, washing, dressing, toileting side of things that perhaps tend to get the most attention in the literature, but a much wider range of activities, including engaging with educational training or maintaining relationships. Now, obviously, a lot of people in prison will have problems with some of these things just because they're in prison. So maintaining relationships with your family or people outside, for example. But the guidance is very clear that in order for people to be eligible, that you've got to have a need that relates to a physical or mental impairment or disability, that it means the person can't achieve outcomes in association with at least 2 of these domains, and that it affects the person's well-being. Part of the problem on the introduction of the CARE Act, however, was that no one really knew how many prisoners were likely to meet these criteria and therefore be eligible for support, what their needs were, or how best to meet them. And although the Act set out quite clearly what the responsibilities of local authorities were, they didn't specify how they should be delivered. So what was the study about, this first study? Well, in essence, it was very simply about how best to meet prisoners' social care needs. And there were 3 main research questions. So we wanted to scope the nature and extent of prisoners' social care needs, to try and identify approximately how many people in prison might meet the national eligibility criteria, and to see if there was a sort of a consensus across local authority as to who those people were, and then to identify the early arrangements that local authorities have put in place to meet these new responsibilities. And the study design had 3 main strands, and I'm going to say a little bit about each of these in turn, both what we did and some of the key findings. So we started with face-to-face interviews, and we actually interviewed 482 people in prison in Lancashire. Lancashire's on our doorstep. It's got 5 prisons which cater for a wide range of prisoners serving long and short-term sentences, different security levels. Importantly, however, it hasn't got a category A prison, and even more importantly, perhaps when you're thinking about these findings, it has no prison for women. So all the findings I'm going to talk about here relate to the provision of care for people for male prisoners. So the interviews themselves took about 50 to 60 minutes on average, and they had 6 elements involving a short bespoke questionnaire which looked at prisoners' demographics, social, criminal histories. We had screening tests for alcohol misuse, for drug misuse, and for mental health problems. And we used 2 screening assessments to detect social care needs, a revolving doors tool that was specially designed for prisoners, and a modified version of the FACE assessment. And as you can see from this slide, somewhere around half and 2/3 of the sample respectively identified as having mental health or substance misuse problems. Although these are probably underestimates, because we know from other research that prisoners are more inclined to talk down rather than to talk up any needs, partly for fear of being reported to prison authorities if, for example, they acknowledge substance abuse issues, and partly just simply not to appear more vulnerable. In addition to that, about 40% of people reported physical health conditions that were affecting their day-to-day life, most commonly musculoskeletal problems, and around 1/4 described problems with their memory or orientation. When it came to the proportion of people having problems with daily activities of living, the numbers go down a little bit. So approximately 1 in 10 had problems maintaining their personal hygiene, dressing and or getting around the prison safely. But when we looked at prisoners aged 50 or over, that rose to 1 in 5. So we're not talking about insubstantial numbers. Approaching a 6 over and above that acknowledged problems forming and maintaining relationships, and a significant minority lack meaningful occupation. Now, we're certainly not suggesting that all these people would have met the eligibility criteria for the provision of social care in prison, but it does nonetheless highlight the substantial number of people, particularly older people, who social care needs impact on their day-to-day functioning, and who could potentially benefit from some form of advice or care of support if they're going to make good use of their time in prison and come out better able to cope in the wider community. And if anyone wanted to find out any more about that data, I'd refer you to this paper, which I know will be in the slides when they're circulated later. And in particular, this explores whether older and younger people's needs were different, and whether we thought there might be a case for a separate response, and our answer in short was yes, we do. So moving on from the interviews, the next stage of the study involved a series of workshops with local authority staff across England. And the idea, as I said before, was to try and start to identify which prisoners might meet the national criteria and whether there was a common understanding of this. So in order to do this, what we did is we looked at our data set to see if we could identify subgroups of people who seem to have similar needs for care, using a combination of 5 variables that seem to be important in determining the nature and extent of people's social care needs. And these were their need for help with activities of daily living, the extent and nature of their mental health problems, whether or not they had substance misuse issues, whether they'd had previous prison stay, and the level of social support. And in combination, those gave us 40 roughly homogeneous subgroups or case types. We then worked with a group of ex-prisoners and we wrote short, what I've called vignettes, but you might think of more as case histories or pen pictures of the 13 most prevalent groups within that data set, based on real people we'd interviewed, but mixed out and anonymized. We then shared these vignettes with 35 practitioners, managers, commissioners from 9 local authorities across England, and asked them to decide, based on the information we provided, whether they thought each one definitely met the eligibility criteria for the provision of social care, definitely didn't, or they weren't entirely sure, they were a borderline case. Not all local authorities reviewed every subgroup, but at least 5 authorities reviewed each of the vignettes. And as you can see from this table, the findings suggested there was considerable variation in the way the criteria seemed to be being interpreted. So there's 2 case types at the bottom here, Chris and Richard, who were generally deemed across the authorities to meet the national eligibility criteria. And I have to say that they were both written as people who had problems with either their personal hygiene and or getting around, who needed physical assistance from someone else to be able to meet those needs. And yet even so, there was a little bit of doubt as to whether they would meet the criteria. At the top of the table, we've got 3 case types who were unanimously deemed not to meet the criteria. And they in the main represented people who were largely younger prisoners, first time in prison, and with mild or no mental health problems and no substance misuse issues. But the interesting bit for us, I guess, is for the rows in the middle, particularly towards the bottom, the sort of Craig, Jacob, Tyler, where the views were much more mixed. And you've got some authorities saying, based on what you've said, we think this person is definitely eligible, and someone else in another authority saying, we think this person definitely isn't eligible. And we looked at, we had a considerable amount of qualitative material around these exercises that we looked at to see if we could make sense of this. And there seemed to be 2 main things going on, really. So the first was the extent to which authorities looked across the 10 domains we talked about earlier. So in some authorities, there was clearly a real focus just on whether people had personal care needs or had difficulty getting around, whereas other authorities made reference to a much wider spectrum of needs. And then the second thing was sort of the timescale that people were thinking about. So in some authorities, they seemed very much focused on here and now, what does this person want today? And in other authorities, they took a much longer term view, and they were saying, sort of, we're interested in what we can do to promote this person's well-being longer term, what we can do to facilitate their rehabilitation, what we can do to turn around lives. And there was a real contrast going on there. And we think perhaps that goes some way to explaining the actual data that ADAS and the Local Government Association collected on social care activity in the first year following the introduction of the Care Act, as shown here, which we were also asked to analyse. And if you look particularly at the figures in the second row, you can see that there's this huge variation between the number of requests for support of people who were assessed, and then the number of people who were deemed to meet the eligibility criteria across different authorities. Now, obviously, when you're comparing data from different authorities, a lot's going to depend on how many prisons they've got, what sort of prisons they've got, what sort of prisoners, whether they've got a lot of people coming in and out, or they've got a fairly stable population. But the Ministry of Justice have groups of comparable prisons. And when you look at those which take account of things like that, the number, size and function of prisons, there was nonetheless still this huge variation in about 40% of the clusters of prisons that we analysed. And we wondered if some of that could be explained by our findings from the workshops. And finally, in this first study, we undertook a local authority survey, as I said, to look at the sort of emerging arrangements. And this had 3 strands, as you can see here. And what we found, oh, I missed this slide. So, and we had a really good response rate. I wanted to highlight that first. So 56% of all local authorities in England responded, and as high as 81% of authorities containing prisons. And what we found was that most had processes in place to identify people with social care needs on their reception to prison. In the main, this had been by means of adding a few extra questions to the existing healthcare screenings that was being done by healthcare staff. But the sort of number and nature of those varied really hugely. So in one authority, for example, they simply asked, did you have a social care package before you came into prison? Other authorities had developed bespoke screening tools. Regardless of that, very few prisons had systematic attempts to try and identify existing people with social care needs, with most of that happening by sort of self-report or serendipitous identification when people saw healthcare staff. In fact, there was only one authority that had made a conscious effort, as far as we could tell, to systematically screen all existing prisoners. And that's despite the fact that, you know, people have changing needs in prison. They're in prison a long time, and we got this, you know, large majority of people in prison in 2015-16 that this data related to, who were already in prison. So when it came to who was undertaking assessments, in contrast to the screening, the formal social care assessments were almost always being undertaken by specialist social care staff. Mostly that was social work staff, but also quite commonly occupational therapists. And in 3 authorities that we had responses from, it was mostly occupational therapists or solely occupational therapists. But there were relatively small numbers of staff involved, so maybe 1 to 4 per authority. And they were organised in a whole range of different ways. So some authorities had developed specialist social work posts for working in prisons. Other people were sharing responsibility across people in generic community teams. And there are a range of advantages and disadvantages to the different options, which we might want to pick up in the discussion later. When it came to the provision of social care in prison, what we found was that many people's social care needs were already being met by the prison regime and or other prisoners, perhaps by sort of prisoner buddy schemes or prisoner orderly schemes. And that much of the work of the social care practitioners was spending time linking people into existing services that other people didn't know existed necessarily, and coordinating their wider health and social care. Where people did have commissioned care and support packages, these were mainly being provided by prison healthcare staff. And the arguments we heard in favour of this included things like they're on site 24/7, they're able therefore to respond very quickly to people's changing needs, and it gives us the opportunity to integrate health and social care in prison. On the other hand, we also heard from people who said that's all very well, but when push comes to shove, what we found is that people prioritise the healthcare responsibilities and social care doesn't get the prominence it needs. So some authorities had commissioned external domiciliary care packages for people to come in, but they brought their own problems. So you've then got to go through all the security, the vetting processes before people can get in. And even before the pandemic, lots of people reported problems with access, particularly at night, or if prisons were in lockdown because of disturbances in prisons, for example. All in all, however, it was very apparent from the survey that a lot of time and effort had been put into trying to improve social care for people in prison, and that arrangements for people on release were far less developed. And when we asked people to identify what the main challenges were at the moment in implementing the Care Act, two of the things people raised most strongly were the difficulties of transferring information between authorities and the difficulties of working with other partners and agencies, both of which are obviously integral to the provision of social care when people are released. So there's some more information about the survey findings in this article in the British Journal of Social Work, but I wanted to move on to just say a very little bit about the second study that we're currently undertaking on the social care needs of people on release, which is a 21-month study due to end in March next year. And it's trying to do or answer 4 research questions. So in particular, it's interested in establishing what's already known about the social care needs of people released from prison, the systems and processes again in place to plan the release of people with social care needs, and that's sort of identifying and planning the release following through post-release. We're trying to come at it from the perspective of the prison establishments, the local authorities and the prisoners themselves. We're also trying to identify the main barriers to and facilitators of the provision of appropriate social care for people on release from prison, and to identify any specific initiatives that have been implemented to support people, not just in this country, but internationally. And I've just got a couple more slides about how we're going about this. So the study design has got 4 main strands, as you can see here. And like many research projects elsewhere, we've obviously been affected by the pandemic, but we have been able to undertake the scoping review. And I've put this slide in just to show you how little literature there really is out there. So this is the results about a couple of weeks ago when I sent Claire the bullet points of the electronic data searches. And we deliberately put our criteria really wide because we wanted to sort of not just look for social care as per the Care Act, and people who defined it that way, but things that seem close. But from the electronic searches, all we got a couple of weeks ago were 27 inclusions, of which only 9 were specifically focusing on this. And I just can't believe how little attention has been paid to the needs of people on release from prison. And it's not just academic literature, we're looking at the grey literature as well, policy documents, voluntary sector reports, etc. We then had, just before the lockdown started to undertake 3 surveys. So the local authority one had gone out, we'd had the first call, and again we'd had responses from 30% of local authorities at that point, which was so encouraging. And then we had to stop, and it was actually the day before the prison healthcare and prison governors surveys were due to be sent out. So hopefully they will be able to resume shortly. We've then got plans for 2 more strands, so qualitative interviews with key professionals and service users in 4 sites that seem to be doing something different. And we have actually been able to identify potential sites for that just based on the literature and the surveys we've had back. And then finishing with validation workshops. But in the meanwhile, what we're doing is taking the opportunity to think about what we might want to do next. So we're already starting to design a longitudinal study of the relationship between the services that people get when they're released from prison and what that means for people's longer term outcomes. And then a separate study to look at the lower level social care needs of people on entry to prison that don't get anywhere near meeting the eligibility threshold, but which seem to be really important in whether people settle and make good time of their time in prison, which we're colloquially calling the dog in the shed bit. Okay, I think that's about me for now. So thank you very much for listening.
Thank you, Sue, for an interesting presentation. We do have a few minutes for questions. If anyone has any questions for Sue or comments about the presentation. No.
One from me, Karen, if that's okay. Yep. So thanks, Sue. That was really very interesting indeed, and well done again on completing that further, that phase 2 project. That's really good, and we're delighted you got this follow-up project in more ways than one in phase 3. So you just said, you said earlier about, so in the phase 2 project, you were focusing on, for obvious reasons, men in prison. Do you think there will be differences if you were looking at women prisoners, or would there be the similar set of challenges?
I don't know whether the challenges will be different, but the needs, we know from existing literature that the needs of women are different in prison. The age profile is different, their family situations are different, the crimes they're there for are different, so they meet a whole different set of challenges when they are released. One of the things we've been talking about now is whether in the next wave of work that we're planning, we should involve women's prisons, and we're thinking that if we do that, we can't do it in a half-hearted sort of way. We've got to design something that's separate, that's actually targeted at them. So I think at the moment my personal inclination would be to try and devise 2 separate things that are complementary rather than simply fit women into a wider study of people's social care needs, but it's something that's up for discussion at the minute. Okay,
thanks, and apologies to Angie. I should read Angie's messages before I ask my own questions. Story of my life, really. There we go. So Angie, you can ask a different question now. No, I've finished. Thank you.
Yvonne, did you want to ask a question?
I was just kind of interested in that. One of the things that local authorities always say is, oh, well, we're all different and we have to do it differently because we're a different local authority. And then you end up with exactly what you have, which is some places doing it really well, places clearly really not doing it really well. I just wondered if you'd had any kind of response from the sector, in how they account for the fact that it's so variable.
Yeah. So one of the things I probably should have said right at the start is how much support we've had from the sector. The first study, the SKIP study, we had huge support locally from Lancashire County Council, but we've also had great support from the, forgive me if I get this wrong, but I think it's the Care and Justice Network at ADAS. Ian Anderson from there has been involved on our study steering groups, and we've had the opportunity to go and talk to their network and to get involved in conferences with the local authority sector. And you perhaps won't be surprised at what I'm going to say in answer, Yvonne, in that it seems to me, and I haven't got evidence to back this up, that an awful lot of it is to do with money. So some authorities have got more funding to be able to put some of these things into place. Obviously, that's not the total answer. Like everywhere, my background, as you know, is in old age psychiatry, and a lot of developments in old age psychiatry have been led by people with a particular enthusiasm and interest in a client group who have really fought for and developed those services. And that's definitely the case in some of the really good authorities that we met. One of the things that particularly struck me, I've been working in health and social care now for 40 years, and I don't think I've ever come across such a committed group of social workers, social care staff, as I've met in this study. And commissioners, I have to say as well. When we try to set up the workshops for the decision data, I said 9, didn't we? We had 9 local authorities. We approached 10 local authorities and 9 of them agreed to be involved. I'm just starting to recruit for the case study work in the SCORE study, and despite being in the middle of a pandemic, people are saying, yes, we would like to try and help you if we can. Yeah.
Okay, so I think we'll move on to the second presentation. So thank you, Sue. Great presentation. So it's now going to be Tanya talking about the impact of climate change on adults in need of care and support.
Hello everyone, thank you for your time, thanks for joining. So my name is Tanya Stern and I'm part of King's College London. I'm part of the School of Social Care Research funded by the NIHR, and I'm looking at the impacts of climate change on adults in need of care and support. So specifically focusing on residential care homes, somewhere where there has been a dearth of research, which I will go into later. So the aims of my presentation is to introduce you first of all to my thesis question and its relevance. So a lot of it is to do with my scoping review. I started in October. So a lot of it has just kind of been situating the question and seeing what kind of information is out there ready. So we haven't actually had the opportunity to go out into the field, of course, with COVID and everything like that. But I will talk about my plans for the study going forward. So I'll present my initial findings and I'll share, as I said, the next stage of my study. So I'm exploring the impact of climate change, specifically on older people in England, focusing on flooding. When I did my initial kind of research, there was evidence that there were healthcare impacts of climate change happening. It was about 8 parameters that include like heat and cold related mortality and morbidity, vector-borne diseases, waterborne diseases, food spoiling and things like that due to increased heat and differences in the food supply chain and things like that. But due to the storm events that are increasing in frequency and intensity on England's coasts, I decided to focus on flooding in general. So why does it matter? Because there's a loss of life, property and contamination. And one of the things that I thought was quite interesting in the initial research is that there seems to be a real psychological element. Right now, a lot of the damages are calculated by, socioeconomic damages or damages to infrastructure, but it's not actually looking at the human experience. So I wanted to talk about people who are most vulnerable in the community. So as you can see here, stress disorder, depression, anxiety, it's all related to the aftermath and during flooding for residents. Many care homes are actually located in coastal and rural areas that are at risk of repeated flooding. And local area resilience plans and disaster and flood risk plans make reference to social care providers, but they don't actually appear to explore it in depth in research. So it's just kind of tacked on the end, usually in reference to evacuations, but not specifically care home research. So here's a picture of residents being evacuated from a care home in Whitchurch. So this is something that's practically happening. This is what it looks like from like an aerial view, and you can see that it's, flooding has completely devastated this area just by Wye Valley. So my secondary research questions include: how is climate change being responded to by the residential social care for older people in England, and what are the effects of climate change on practice and lived experience? So I actually want to look at you know, staff, how are they responding to the impending threat of climate change? Do they even see it as a concern? As it is, everyone is like looking at coronavirus and everything like that. So that seems like something that is more on the front line or more immediate. But one thing that came out throughout the research is that while the pandemic couldn't be going on, a flood can still hit. So this is something that we need to address as something that can occur at the same time. So the multiple kind of burden on more vulnerable people in the community of these kind of events that are happening. And yes, so I'll be analysing examples of care home practice and service responses to climate change as it stands. So it's very alarming. So the first steps that I took was a scoping review, and the title was The Impact of Climate Change Related Floods on Care Homes for Older People. And I used a method suggested by Spiel in 2019, which is going through 12 databases, so very comprehensive. And the findings suggested that specific evidence on risk and impact of flooding in adult social care was very limited. The term vulnerable location tended to refer to hospitals, but vulnerable people are not often specified, and care home residents were, I could actually describe them as invisible and overlooked in regards to this context. So it does need a lot more research. So my inclusion criteria, of course, was England, older people, care homes, and, you know, climate change related flooding. We weren't interested in, you know, flooding related from a burst pipe or anything like that. One of the issues that I'll talk about later as my limitations was that a lot of data for England is kind of conflated with the wider UK, and there are actually differences between the different countries and how care is provided. So this was my initial search result. So when I searched the 12 databases, I only got 2 studies. So you can see that this is an area that's completely under researched. And one particular thing that I would like to point out is the keyword analysis. So there were research focused on adult social care or care homes, and then there were research focused kind of environmental issues, flood risk, risk perception, as you can see from the words here. And the issue was that even though these studies talked about adult social care, as I said in the beginning, in passing, and they made cases for evacuation and talking about how vulnerable these people were, specifically, you know, older people, the older people who are 85 plus, perhaps mobility issues, need people to actually assist them to move around, as Sue mentioned, like personal care and all that kind of thing, including even pre-existing psychological impairments, maybe dementia. Over 70% of people in you know, England's care homes are diagnosed with dementia or some form of memory loss or orientation issues, and 90% of those people in a census were classified as having high needs. So these are people that are very vulnerable, and there isn't a lot of research dedicated to these specific people, and part of it is because of the keyword analysis and a complete kind of division between environmental and adult social care. So areas of that had high populations of older people and extremely vulnerable to floods included East Anglia, where 68 out of 550 care homes in the region were actually on land at risk of being flooded repeatedly. One thing that came out is poor management and flood planning tools and infrastructure flood defences. So on one hand, you had the physical infrastructure such as the pumps for, you know, drainage. For example, in Hull, in 2007, those failed and there was flooding. So there's the poor management and upkeep of that. One of the issues that came out was who is responsible for maintaining that. Again, similar to what Sue was saying about, you know, management or local authority issues. And also staff reported that, well, first responders even reported that they were unaware of, you know, flood planning tools that would actually enable them to assist in evacuations and things like that. So 1 in 100-year climate change scenarios are happening more frequently. This is why it's something that actually needs to be addressed. Evacuation was a theme that appeared in 7 out of 9 papers, even though it is being left out as being classified as a vulnerable location. And the impacts of flooding have longer term psychological effects. And as I said, you know, care workers, managers, they're actually describing in previous research that, you know, their ability to respond is limited because of the information that they're not getting or they don't have in regards to becoming prepared. So one of my limitations were lack of universal definitions when looking at the research, and also no quality assessment tool such as CASP was applied, because after getting only those 2 papers, I switched my method to doing a citation backtracking, where I actually picked out from the references related studies, and then from that I managed to get 9. So I was unable to narrow down those 9 studies any further. English language only. So areas that came out for future research included establishing social care responses before, during and after extreme climate related disasters, the short-term and long-term psychological impacts of climate change, including the floods for both residents and staff, and the impacts of successive floods on care homes. So as I said, people in vulnerable areas that before they even recuperate from one flood, maybe Storm Shara, Storm Dennis has come along. So, and as I mentioned before, the comorbidity of disease and climate change, vulnerabilities. So COVID, we're going into flu season now. These are things that already make older people vulnerable. And environmental disaster planning in care homes. So my plan roughly is to do expert interviews to just find out what's the knowledge. I want to follow the kind of interview structure that a previous study came out in my scope and review, where they compared like France and England, and they were looking at care home managers' response, and are they aware of the tools that are available to them to actually create disaster plans. Another element is I want to look at the documents that are already in existence, so that's the documentary analysis, and then of course transcribing the expert interviews, pulling out themes that come out from that, and that's going to help to inform the next stage of the study, which will be looking at particular case studies of care homes, going in and actually doing that research, interviewing, you know, the managers, local authority staff, perhaps, you know, even residents, people who are being affected, family of residents that are being affected by flooding, which I will of course get ethical permissions for. So one thing to of course consider is DBS clearance going into a care home, and also talking about potentially distressing events, offering anonymity and obtaining informed consent, the usual. And my references. Thank you. Any questions?
Any questions, Tanya? It's really good, interesting presentation.
Okay, there's one here. What interested you in this topic for a PhD? So I did my undergraduate degree in public health, where I became really interested in health inequalities. So there's a guy called Bullard, I think it's 1990, and he's done a lot of research on it, particularly on African Americans. And he talks about how there's a disproportionality in the health effects experienced there. So, you know, women more likely to die in childbirth, Black women or ethnic minorities, Black people more likely to die from asthma because they live in areas that have been zoned like previous, like asbestos use and things like that. So I became really interested in, okay, there are things going on in the community, but there are certain people that are being affected more by it. So yeah, that's how I started to think about vulnerable communities. And then I did my master's in international relations, and I got really interested in a module called global environmental politics, and then I got really interested in the environment. So I kind of put the two together, where okay, vulnerable people, and then I looked at, you know, environmental challenges, and yeah, kind of just merged the two together. And because of my funding from the NIHR, I did just narrow that down and say older people instead of, you know, I could have done ethnic minorities, I could have done like children. One of the research papers that came out was the flood effects experienced by children, which was excluded in my initial search. So yeah, that's what interested me. And David, your question?
Oh, thanks, Tanya. It's really interesting. And I was kind of interested while you were talking about that whole intersectionality issue, and conscious of the papers that will probably feature in your broader PhD about, you know, for example, the intersection of disability and natural disaster and climate change, and thinking about that famous Hurricane Katrina example of,
yes, exactly.
And then some of those other intersectionalities about, you know, people in poor housing, or I was what it put me in mind of was some of that literature got developed to problematize the idea of the vulnerable, or the label of the vulnerable. And actually to see people labeled as so-called vulnerable as people who are very kind of expert and skilled up at thinking about risk and climate change, and some of the aspects related to risk and perhaps natural disaster or climate change, because in their everyday life they're having to kind of problem solve and think about how to respond to scarce resources, or how to deal with kind of physical limitations, and how to deal with inaccessible environments, and so this idea that actually the so-called vulnerable may be the people who can tell us a lot about how we might reorganize things to mitigate against inequality. Sorry, it's a very long, but anyway, I just, you know, has all that kind of literature come across? I know that wouldn't have helped you with your scoping review, which had a very specific
focus.
Yeah. But
I didn't actually come across that kind of thing though. Definitely, as you even mentioned Katrina, I feel like that's the one that kind of just comes to everyone's mind. It was the thing that kind of shook the world in relation to maybe adult social care interacting with the environment. And yeah, definitely looking at like the census data for, you know, Bupa, previous healthcare, social care provider, they were talking about how many people are, you know, actually dependent, as you said, you know, more at risk because they need help to move around and things like that, and things just being accessible. So that's something that we do need to look at in further detail. And yeah, I'm very interested in the intersectionality of things. So just because we don't live in a compartment, so things are always happening at the same time. So you always need to consider, even within care homes, that, you know, people will still be experiencing it on a different aspect. Because when I was looking at it and I was trying to define my age group, for example, there was a difference between residents who were 65 plus or 60 plus, 60, 65 plus, and those that were 85 plus. You know, they had different needs. So that was something that was interesting that came across, that, yeah, definitely will feature in the wider scope of the study.
I mean, I'm happy to send you some of the bits of references that I picked up when I was looking into this topic, so I can happily send you this. And good luck with it. It's really interesting.
Thank you. Yeah, I would love that.
Another question for you, Tanya, regarding international evidence, would you consider areas in addition to Europe, such as America and Southeast Asia, where flooding is a big issue?
Oh, I would love to. that would be, I feel like people don't really think of Europe or the UK so much when it comes to being most at risk, which is why I guess I'm zooming in on a particularly vulnerable population. But yeah, we could talk about the, you know, Pacific Ring of Fire, for example. That's like a personal, not favorite, but, you know, having looked at, you know, global environmental politics, the Pacific Ring of Fire, constantly experiencing, you know, volcanoes, earthquakes, tsunamis, I mean, over 200 a year. So if I was offered another opportunity with, you know, more funding and different kind of things like that, then of course, I feel like that's even a more obvious area to look at. But just for the scope of this, I do have to narrow down. I do have to stick to not even the UK. I do have to stick to just England. But definitely, that's something that needs further research. And I think a lot more issues will come into that, because we're looking at, you know, developing nations and their capacity to cope is completely different. And yeah, it would be, maybe the burden will perhaps be on, you know, individuals or ground up groups kind of trying to, you know, not protect themselves, but yeah, kind of ensure their own safety. Whereas here we do have a bit of a safety net with having the local authorities as the designated people who are supposed to kind of look after these groups. So yeah, thank you for that question.
There's a comment from Yvonne. Doncaster had really shocking floods this year. Really research active local authorities. I'm sure they'd be keen to work with you.
Doncaster. Oh yes, we'll do. One of the plans is to send out, well, just get in contact and get all the current disaster risk plans and things, documents that people, all these care homes already have in place. I went to a Parliament event and I met Parvan Dalwar, I hope I got her name right, but she is one of the care home manager. She's care home manager of all the Methodist homes. So she was the one who actually told me to, you know, Freedom of Information Act, get those details of, you know, current disaster planning and stuff, and that they should actually already have some kind of you know, plan. So get it, analyze it, see where there are gaps, see where there are strengths, and that way I could also analyze, as Sue kind of mentioned, the different capacities to cope because of like different local authorities and things like that. So that's something that I wanted to look at as well, because in no way am I suggesting that, you know, adult social care is a homogeneous entity and everyone's going to respond in the same way, or everyone's going to even have the same ability to respond. Yeah, so that's definitely something that I'll look at. Thank you, Doncaster. I remember.
So we've now come to the end of the webinar. So thank you, Sue and Tanya, for two really interesting presentations. Our next webinar will be on the 11th of August, and the presentations will focus on developmental disabilities. SSCR will be inviting full proposals for research projects to address priorities for improving the evidence base for adult social care, and Andrew will be sending out a link this afternoon on that call. So everyone that attended this webinar, thank you for attending, and I wish you all a good afternoon.
Thank you.